Assalamualaikum warahmatullahi wabarakatuh. We are from Group 1 and we will be presenting about solutions to Alzheimer's disease. My name is Nurul Izzati Binti Ramli and these are my group members. The problem statement is, how can we help Alzheimer's patients after they were diagnosed with the disease? So our main focus here is the solutions to Alzheimer's disease. Let's get started with an introduction. Alzheimer's disease is a neurological degenerative illness that causes brain cells to die and the brain to shrink. Alzheimer's disease is the most common type of dementia, characterized as a gradual decline in cognitive, behavioral, and social abilities that limits a person's ability to function independently. Alzheimer's disease affects around 5.8 million persons aged 65 and up in the United States. 80% are 75 years old or older. Alzheimer's disease is thought to impact 60 to 70% of the approximately 50 million people worldwide who have dementia. Next, what are the causes of Alzheimer's disease? The first cause is age. Alzheimer's disease is not a natural part of aging, yet as you grow older, the risk of getting the illness increases. The second cause is family history and genetics. If a family member has Alzheimer's disease, then your chances of having the illness are somewhat greater. But this is a rare occurrence that accounts for less than 1% of people with Alzheimer's disease. The third cause is head trauma. Adults over the age of 50 who suffered a traumatic brain injury (TBI) have an increased risk of dementia and Alzheimer's disease. Alzheimer's disease may affect the patient physically and mentally. Some of the effects are severe memory loss, disability to carry out daily tasks, difficulty in concentrating and thinking, and causes behavioral changes.
Next, we will move on to the solution. The first one is the cure-oriented solution, which is health technology assessment, which may also be abbreviated as HTA for short. The health technology assessment is the project that conducted a research on early molecular diagnostic of Alzheimer's disease. The HTA setting is part of research on early molecular diagnostic of Alzheimer's disease in the Netherlands that is taking place within the LEARN program, which is Leiden Alzheimer Research Netherlands, and is partially financed by the Ministry of Public Health. One of the conditions for this funding was the clinical and societal relevance of the research. Therefore, the consortium devoted one work package to a health technology assessment to evaluate early molecular diagnostic, clinicals, and economic value. It investigates how different instruments perform, how much they cost, as well as how the quality of life and healthcare costs change through the introduction of early diagnostic tests. The health technology assessment includes monitoring a cohort of patients to measure the accuracy of different diagnostic instruments and the quality of life. Next, a panel to determine the added value of this instrument in clinical decision making, and a model to assess the cost of healthcare consumed by patients and their informal caregiver. Lastly, medical professionals such as neurologists, psychiatrists, geriatric and radiologists, chemical analysts, and health economists work together and exchange knowledge and ideas.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Nomar binti Sofyan with my shirt number 121178. So I'm going to continue the video presentation by explaining the solution. So one of the solution that we can implement to help the patient that were diagnosed with the Alzheimer is a care-oriented solution, which is a series of Alzheimer's Cafe, or also known as the Memory Cafe. Before that, let us understand what is Alzheimer's Cafe. What is Alzheimer's Cafes? Alzheimer's Cafe was founded first in the Netherlands. It is also known as the Memory Cafe or the Dementia Cafe. Alzheimer's Cafe have become very popular and easily transferable program that used to connect people. It also become a booster support to the Alzheimer patients in many countries around the world. Basically, Alzheimer's Cafe is a monthly informal event for persons with dementia, their partners, family members, caregivers, or other interested person. In this cafe, they provide a space and time for the visitors to informally exchange ideas, information, and experiences. It also provides support to the individual persons with dementia or their relatives to help them deal with the situation. Let's move forward with the purpose of the Alzheimer's Cafe. Firstly, Alzheimer's Cafe initiated to tackle the taboo on dementia within the society, partners, and the families. Secondly, Alzheimer's Cafe helped to discuss patients' own dementia diagnosis, get answers from the health professional, and make new friends to feel more confident. Thirdly, Alzheimer's Cafe will help to educate, to speak openly about the problem, and to recognize and emancipate the patients and family members. According to Haro van Lande in his article, Early Diagnostics and Alzheimer's Disease Beyond Cure and Care, he stated that more than 800 Alzheimer's Cafe were listed in the United States. This big increase in number shows that Alzheimer's Cafe is an effective way to help the Alzheimer's patients, although it is a non-medical setting. So how does the Alzheimer's Cafe work? In terms of timing, it usually takes around 1.5 to 2 hours once a month on a basis. For the venue, it should be a warm and a welcoming space, not too big or noisy such as a public cafe, restaurant, or a room in a community space like library, museum, or park. By being in a public space, Alzheimer's cafes also help to break down the stigma around the dementia. Secondly, easy access and plentiful parking, wheelchair accessibility and disabled parking, some food and beverages for purchase, and preferably not a venue that related to the senior care or medical system to foster a relaxed social environment for the Alzheimer's patients. There are a lot of interesting activities in the Alzheimer's Cafe, for instance, socializing and supporting the Alzheimer's patients. They also have a theme each month with some cafe and table decoration. Some cafes also incorporate interactive activities such as sing-alongs, creative arts, and storytelling. They also provide sharing sessions with the medical professionals, friends, and caregivers. For the staffing, at least one consistent person to act as a host or facilitator. A host should be someone who enjoys socializing, welcoming, and has some experience of being with the people with dementia. Now, let's understand the pros of the Alzheimer's Cafe. Firstly, Alzheimer's Cafe make people with Alzheimer's feel more engaged and manage to adapt with the new challenges and environment. It also provides useful information related to Alzheimer's disease. And lastly, it lessens any anxiety and irritability that Alzheimer's may bring.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Masturina binti Ami Hamzah with metric number 1211144. Today I will continue the explanation about the recommendation and justification. So, the recommendation to cure this Alzheimer's disease is a medication. Based on National Institute of Aging, several prescription drugs are already justified and approved by the US Food and Drug Administration (FDA) to help manage symptoms in people with Alzheimer's disease. Here is some important points and explanation more about medication. Treating Alzheimer's symptoms can provide people with comfort, dignity, and independence for a longer amount of time, as well as motivate and help their caregivers. Galantamine, rivastigmine, and diazepam are cholinesterase inhibitor used to treat mild to moderate Alzheimer's disease symptoms. Some cognitive and behavioral symptoms may be reduced or controlled by this medication. Aducanumab was approved through the FDA's Accelerated Approval Program. Aducanumab is the only Alzheimer's disease modifying drug currently approved for use. This drug is a human antibody or immunotherapy that targets the protein beta amyloid and aids in the reduction amyloid plaques, which are brain lesions linked to Alzheimer's disease. Only persons with early stage Alzheimer or mild cognitive impairment were studied in clinical trials to establish the efficacy of aducanumab. In conclusion, we might infer that our study underscores that varied approaches to Alzheimer's disease are intimately related to how we see the problem and respond to it, or look for a solution. There are several solutions that we can find in this article, such as Alzheimer's Cafe, or we call it Memory Cafe, and Health Technology Assessment (HTA). Another recommendation that can assist, cure, and care for this ailment is medication.